Immigrant and migrant farmworkers make up the majority of the farmworker population, yet their health has been largely ignored for decades. In the U.S., 76% of farmworkers are from Mexico, with 70% being Spanish-speaking males, and there are increasing numbers of indigenous workers with various health needs. The social determinants of health, such as economic instability, unsafe housing and working conditions, and lack of access to adequate health care, are leading factors as to why immigrant and migrant farmworkers are at a significantly higher risk for work-related injuries, chronic diseases, and other negative health outcomes. The strenuous but essential job requires farmworkers to work long hours in unsafe and unacceptable conditions, yet their income is insubstantial when compared to the demands of the job. Due to this inequitable compensation, affording adequate nutrition, essential health care, reliable transportation, and many other necessities is a common strain. Additionally, the language barrier is a major issue that likely leads to more work-related injuries by hindering farmworkers' ability to understand how to properly operate farm equipment. In addition to physical injuries, the unsafe housing and working conditions places farmworkers at a higher risk for other health issues, such as exposure to chemicals and biological agents, physical hazards, and mental and psychological stressors such as fear and social isolation. Access, availability, and affordability of health care creates the perfect storm that prevents immigrant and migrant farmworkers from obtaining the care they need. Even though the implementation of migrant health centers that provide care to farmworkers and their families has improved accessibility, affordability is still a major obstacle that prevents or delays essential care. With the various barriers that greatly contribute to the vulnerability of this population, immigrant and migrant farmworkers require advocacy and assistance from people who can not only do something about this issue but benefit from their actions as well. For example, the U.S. government must recognize their position in this issue, or else they will have to rely on outside sources to obtain the country's food supply. Simply put, the more negative and debilitating health outcomes that occur, the less farmworkers there will be to keep the farms functioning. By establishing laws and requirements for safe working conditions, adequate housing, equitable pay, and more actions with the purpose of promoting the health of foreign farm workers, the U.S. government, the public, and farmworkers all benefit. Additionally, the farm employers have the power to manipulate multiple factors that determine the current and future health outcomes, such as the social determinants of health. By not providing their farm workers fair compensation, safe working conditions, an environment free of violence and harassment, and other relevant demands, employers are putting their farm, crop, and productivity at risk. Employers have the ability to improve conditions for their farm workers, and with the hopeful cooperation of the U.S. government, non-native farm workers can live and work in a safe, trusting environment while contributing significantly to the U.S. economy. As for your support towards the Farm Workforce Modernization Act of 2021, which is a pending legislation act that includes many actions with the purpose of protecting non-native farm workers, including proposed changes made to the H-2A program. The H-2A program permits U.S. employers to bring temporary foreign workers into the U.S. to perform seasonal agricultural work. I also ask for your support towards the development of nationwide mobile health clinics that are dedicated to serving the immigrant and migrant farm worker population. Mobile health clinics are able to provide education regarding prevention and patient protections that can be easily understood by the specific population they are serving. In addition to conveying a sense of comfort and understanding that has been unknown by this population, mobile health clinics are able to provide accessible, affordable, and essential care to immigrant and migrant farm workers that has been absent for far too long. Immigrant and migrant farm workers are suffering at unprecedented rates from negative health outcomes that can be prevented or improved with appropriate and timely action. The negative health outcomes suffered by farm workers may not be directly felt by every U.S. citizen at this moment, but that does not mean it isn't a public health crisis. If actions aren't taken to alleviate this crisis, then every U.S. citizen will feel repercussions when food insecurity affects every household due to a minuscule amount of farm workers. The promotion of public health is emphasized by healthcare professionals and government officials in the U.S., and it's about time the health of immigrant and migrant farm workers are included in that focus.